This week, over 1,500 people in the Republic and close to 450 in Northern Ireland have lost their lives due to the COVID-19 pandemic. And our first thoughts, as Taoiseach said, must be with them, their families and those who are today still struggling to overcome the virus. The virus remains a serious threat, and there is no basis whatsoever for arguing for a rapid lifting of all restrictions. However, there are significant questions to be asked about actions on particular issues. The restarting of basic parliamentary accountability is welcome, and I would like to acknowledge the constructive approach of the COVID-19 Committee and its elected chairperson, Deputy McNamara. We wish it well in its work and expect that all who are asked to assist it will do so. We should increase discussions about what can be done to bring the Oireachtas back to as close to normal working as possible, consistent with the public health situation. There are many critical areas where public oversight and debate is required, and deputies are eager to be able to fulfil their mandates more effectively. As I've said here over the last 2 months, during a fast-moving and unprecedented crisis, the last thing you can afford is to be defensive when issues are raised. The most comprehensive and effective emergency responses always involve making space for challenging voices and a willingness to quickly and comprehensively admit the need to adopt different approaches. Undoubtedly, mistakes have been made and are being made, but I think it is important to reassure everyone involved in the response across our public sector that no one expects an error-free response. The expertise of the professionals involved is something we must respect and honour. There are judgment calls to be made, and there is a central role which must increasingly be played by broader public policy. As long as these judgment calls are based on a full engagement with the science and an inclusive and transparent procedure, we should acknowledge the good faith involved. This is why when we reach a stage where we must turn to planning future responses to either a second wave or a new pandemic, we need to adopt an approach of learning lessons rather than seeking to apply blame. And we need to have a more inclusive and multidisciplinary approach to how measures are developed and agreed. And I especially say that in the context of reopening and lifting restrictions. We do need a multidisciplinary approach. I get a sense that the multidisciplinary dimension is not as evident as it might be. During these debates, Fianna Fáil's spokespeople are setting out a range of questions based on the input of people from every sector and every part of the country. And I would like to acknowledge the constructive and helpful way in which both individuals and organisations have been contacting us to give their observations and their concerns. As has been said here every week over the past month, the deal in relation to private hospital capacity simply has to be reviewed. It is now a full part of a system-wide problem of the collapse in diagnostic and treatment activity for non-COVID cases. And there is a significant underutilisation of vital hospital capacity that is no longer justifiable. My party believes that as we move into a wider challenge, there is a need to more systematically engage sectors and general expertise in the discussions. As we pointed out last month when it was announced, the failure to include childcare professionals in the discussions in the design of childcare supports for frontline workers was a fatal weakness in the government's approach. As such, no one was surprised by yesterday's announcement that the main scheme has been suspended because only 9 providers were willing to participate. And I do acknowledge the difficulties in this entire area around the public health dimension. Similarly, we learn from the internal proposals concerning the Leaving Certificate, which are outlined in the media this morning, and which show a process which should have led to a much earlier announcement, in our view, of the cancellation of exams. Deputies were inundated with calls from parents, teachers and students for a long period of time in relation to this. And these documents show that there was no credible way on the discussion to maintain social distancing, employ enough invigilators, or even to examine more than half of the normal range of topics. The uncertainty and public disagreements about what should be done could have been avoided if this information had been shared much earlier. Instead, we had a debate based on the false premise that there was a confidence that the exams could be held. The private hospital deal was an emergency response to the need to create a surge capacity. For nearly a month, it has been clear that this surge capacity is not likely to be required at present. In recent days, it was suggested that extra capacity might be used now to treat public patients, or that 30% of this, the Minister said, of the private hospital capacity. Others from the private hospital sector are saying only 30% of the capacity is being used right now. And we believe in general hospitals, in the public system, that about over 1,000 beds are vacant or underutilised. Overall, I think the situation is a mess. I've been pointing this out for 6 weeks. The failure to get a proper consultant's contract negotiated has gone on too long. The deal with the operators was one of mutual convenience. The state needed surge capacity. The operators, if you like, have all their expenditure sorted in the initial phase, probably where their revenue wasn't coming in. So I think there needs to be a comprehensive strategy. There's a lack of one at the moment to get that hospital capacity back as comprehensively as possible. I think it's been a very expensive deal. I understand the rationale behind it, not criticising the rationale behind it, but it's been coupled now with a wider underutilisation of vital capacity, and we're hearing stories about cancer patients, heart patients and other patients who could have had treatment, who could have had earlier procedures, but haven't had because of this prolonged paralysis, if you like, in terms of reaching comprehensive agreement. There are many proposals emerging, and I think it's important that they're engaged with in a proactive and systematic way. For example, the numbers of people who need early diagnostics has not declined. I think the teacher has referenced this himself. Yet the number accessing diagnostics has drastically fallen. It has been suggested by some that a procedure, if we pre-test every diagnostic patient in advance, it would allow many facilities to operate at close to normal capacity. It's a perfectly legitimate question to ask about why we are spending many millions on hospital capacity we do not believe we will need, and which we could quickly recontract were an unexpected surge to happen. The situation in relation to meat plants is gravely serious, and it's not obvious that these clusters are being dealt with comprehensively. Now, without calling for the shutting down of the sector, it seems very surprising that the blanket testing of a facility is followed by no interruption of work until the results are returned. Would it not be reasonable to halt production for a deep clean and putting in place of new control measures while waiting for the results? Simply sending workers back to work and indeed not testing their families does not make sense, particularly given the Minister's assurance that testing capacity is not an issue. I think there's been a significant lack of transparency in relation to this issue. I've dealt responsibly with it. I've alerted authorities up to 6 weeks ago, 2 months ago, about the dangers of what could happen here. And the numbers are high. The numbers are high in towns across the country where ordinarily there wouldn't have been a high incidence of COVID-19. And I think more needs to be done in relation to this, and people need to get on, the authorities need to get on the factory floors to see the reality for what itself. And táim bortha, fina monarch in fiola, an aspa saléru, agus an aspa corla, tá na hivracha an order fad, der éna figuri agi atá ag tachtamach in dig na tastálacha, agus ní dólam gwil seo sásúil in écr. In Malta, timppla tíre tá Dáiltena, Saléra agus Faragus mihuinas ag méadú an támar fad. The thugus cóla, cúpla seachtainna hin madar le seo, agus tá sé nám I mothúramse, dus na údarás dul úlár na monachan, chun an réaltacht eáil agus caithfidh siad sin a dhéanamh. I think we should acknowledge the excellent work also of many journalists at national and local level in being willing to ask tough questions. The fact is that many issues fundamental to the response have only been fully explained to the public because of their persistence. The simple fact is that testing and tracing is fundamental to increasing our options, and it is happening faster in other countries. In recent days, an issue about the lack of integration of records and the impact of errors in data inputting has been revealed. It has been said that we need the entire testing and contact tracing continuum to be completed within 3 days. However, information supplied by the HSE to journalists yesterday says that the median time the process is taking in the community is 5 days, with many examples of much longer times. Much has been achieved, and since the issue of capacity delays and missed targets for testing was a dominant one, this has to be acknowledged. However, we need to hear clarity on what is to be done to bring down testing and tracing times so that we're happy that we can quickly identify and respond to new clusters. We hear a lot about plan. I think we need a national strategy on testing. Who we test, where we test, and to use our capacity to the optimal degree and benefit. In relation to face coverings, the issue has gone on for too long. There is a broad scientific acceptance of two basic findings. First, basic coverings do no harm in practice and appear to limit the spread. Second, they are an important part of encouraging appropriate behaviour in public and are critical to getting public confidence to a stage where public transport becomes a viable mass transit option again. Fears that the introduction of a face covering policy would undermine the supply of PPE seem overblown when you see the impact in many other countries. It's time for this issue to be definitively addressed. It's dragged on for far too long. And we also need to hear much more detail about the exact financial impact of the crisis on our public companies and institutions. The Dáil will soon have to have a substantive debate and vote on financial matters, so we need to start having an informed discussion now about what emergency measures may be required to support these companies and institutions. Fianna Fáil would like to acknowledge yesterday's High Court ruling on the validity of emergency measures which the Dáil has agreed in recent months. Quite apart from the legal position, there is also no doubt about the strong public support for these measures. I believe that this support will continue, but what we need now is a more inclusive and transparent process for discussing how we proceed. We're out of the acute phase of the response, and a much broader range of voices need to be brought into the discussions. Only then will we retain public support and ensure that policies are soundly based and effective in both opening up our country and ensuring that we limit risks to public health. Thank you, Ceann Comhairle.